Well, hi everyone. My name is Allie Kamenzind. I am a campus recruiter here at Cerner Corporation. I appreciate you logging on and spending some time with us this afternoon. Just kind of a general overview of the session today. I want to give you a basic overview of Cerner, who we are, what we do, and then talk to you a little bit about some of the opportunities we have for college graduates. So I'm going to kind of give a general Cerner overview, kind of talk through some of our entry-level opportunities, and then I have a few other recruiters joining me a little later in the presentation. Taylor Hill is our IT Works recruiter, and she's going to be talking about our IT Works site. So although we are based here in Kansas City and a majority of our opportunities are going to be in the Kansas City area, we do have a lot of other locations around the United States that we hire Cerner associates to as well. So she's going to touch on that. And then Tessa Wood is our referral and diversity recruiter, and she's going to talk about our veteran hiring efforts at Cerner because Park has such a great veteran population. So we want to kind of touch on what we're doing there. So to go ahead and jump right into that general overview, basically want to talk about, why we do what we do here at Cerner. And the real reason is because of the state of the healthcare system as it is today. So as many of you know, the United States probably isn't the most efficient country in the world when it comes to healthcare. There's a lot of challenges and a lot of issues happening in the system. And Cerner, we really believe that we can use our technology to help curb some of those problems and help, make that healthcare system run a little bit more efficiently and effectively. A really good functioning hospital actually operates at about a 3% profit margin, which is actually really, really low. And that's a hospital that's doing really well. Most of the hospitals actually operate in the red. So the cost of healthcare is something that's an issue. And with our revenue cycle solutions and the things that we're doing, with technology, our goal is to not only make healthcare more efficient and more safe for patients, but also kind of reduce the costs for hospitals. Therefore, you as a patient don't have to pay as much out of pocket. So just to kind of start from the beginning about Cerner and who we are, Cerner was founded in 1979 by our three founders. Two of those founders are still very active in the company today. Our three founders sat down and knew that they wanted to develop software, and they wanted to develop software that was actually going to help people. So their very first client was actually one lab in one hospital. And that single lab thought that automation was really going to be the kind of the cure for the issues that they were having within their laboratory. So our three founders developed our very first solution that we call PathNet to kind of help run and make that one lab more efficient. So from there, we now have over 24,000 associates that work at Cerner. About half of those associates are here in the Kansas City area, and the other half are going to be all over the globe. So we are an international company. Cerner is live in over 30 countries right now. Obviously, healthcare is not something that only takes place, in the United States. Every single person in every country needs healthcare. So very international. We're growing our international presence, each year. We have over 25,000 client facilities worldwide. We spent over $4.9 billion in R&D investment. That's something we're really proud of. As Forbes listed us in 2015 as one of the most innovative companies in the world. And really, that's kind of our drive, is our innovative spirit here at Cerner. So we're really proud of the fact that we're, taking the money that we're earning and making and really, filtering that right back into the company and right into being more innovative. And then in 2015, we also earned $4.4 billion in revenue. So who exactly are our clients, and what does that look like? Well, in large, our clients can really be anywhere where health and care take place. So obviously large and small hospital systems, pharmacies, physician offices, those are always going to be the bread and butter clients of Cerner. So we're always going to keep providing solutions to help run those hospital systems. But as you can see, we have a lot of unique clients as well. A few of them being the NBA and MLS league. So Cerner actually developed a software solution called Healthy Athlete. That's a specific solution to help track and maintain the health and wellness of those professional athletes. So know a lot of great people that get to work with some very interesting clients on that space. Another few of our kind of more unique clients are going to be other large companies like J.E. Dunn or Frito-Lay. What Cerner does for large companies like those is, I'm going to talk a little bit about our benefits a little later on in the presentation, but the way that Cerner manages our own health insurance, our personal wellness, and really the way that they track and take care of their own internal employees, we do such a great job that other companies come in and decide to pay Cerner to go out and implement those same sort of programs. So we go into companies like J.E. Dunn and Frito-Lay and implement the same sort of benefits and wellness packages that we offer here for our internal employees. And then if you kind of see the data center magnifying glass over on the right-hand side, another large part of what we do at Cerner is our clients can choose to have Cerner store and maintain all of the data that's being entered into our software. We actually have a data center here in the Kansas City area that holds about 40% of the entire United States health data. So that's going to be a large part of our business as well, is storing and maintaining and securing all that health data for our clients. So just a few personal stories on kind of how it impacts our clients and why we do what we do. A fun fact is that 90% of every single person born in Sweden is documented in a Cerner system. Obviously, Sweden isn't a very large company, but the fact that 90% of every person born there is automatically loaded into a Cerner system is really neat. Another cool fact is that one of our clients' Banner Health system has saved over $1 million in the past 3 years with our Cerner Millennium and patient e-signature solutions. Like I mentioned, our solutions obviously make things run more efficient and effective, so doctors cannot make errors, but saving our clients money and saving patients money is something that we're really passionate about as well. And then my favorite fact is one of our clients, Trinity Health, has saved over 500 lives and $22 million with our sepsis solution. So for those of you that don't know, sepsis is actually a blood disease. And a lot of people actually contract this disease while they're already in the hospital for something else. So someone goes in, for a surgery or for something routine and ends up contracting sepsis in the hospital. The thing about sepsis is that if sepsis is caught within the first 24 hours, it's very, very preventable. If it's not caught within those first 24 hours, it's actually very fatal. The reason that sepsis is so important to us here at Cerner, our CEO's sister-in-law actually died of sepsis. So he was really passionate about using technology to help prevent people from dying from this disease as well. So what our engineers did at Cerner is they actually created an algorithm that is placed onto our Cerner software that can take a patient's chart, crunch a bunch of data and actually alert doctors and nurses when that patient is at risk of sepsis. That way, those nurses and doctors can take action right away and prevent that from being a fatality. We're so passionate about this sepsis prevention that we provide this algorithm and this software solution 100% free of charge for all of our clients. So I'm going to talk a little bit now about kind of our entry-level opportunities and what that looks like at Cerner. We have a lot of great entry-level opportunities on the business side and the technical side. So I know obviously Park offers a very wide range of majors, so I'm going to kind of go through briefly all of these entry-level opportunities that we have. The thing to note about this slide is we have a very wonderful training program here at Cerner. So every single entry-level opportunity that we have is going to have a training program attached to it that we call our academies. So I'll kind of talk through each of these roles and then talk about that corresponding academy. So the first position is going to be our business consultant position. This is going to be a business-focused position at Cerner. We hire a wide variety of business majors into the business consultant program, anywhere from finance to business management, marketing, econ. The business consultant role, they're going to go through our Ops Academy training program. The way that it works is candidates come in, go through our Ops Academy training program, which is going to be 4 weeks of classroom-based training. After that, they're placed out in the company on a team for an additional 5 weeks on what we call a lift. And what that lift is really your opportunity to dive in, start working on that team, and figure out, is this team and this work going to be the best fit for me at Cerner? So, for example, let's say that you go through the Ops Academy and you're placed somewhere in our finance department on your lift and you're working with our finance data. You do that for 5 weeks, and at the end of the 5 weeks, you think, that was really great. I really enjoyed the work. I enjoyed my team. At the end of that 5 weeks, you'll then be permanently placed on your team, and your name will then change from business consultant to maybe financial analyst. The really great thing about this business consultant opportunity is that if you do go on that lift for 5 weeks and you feel like maybe that work and that team wasn't the best fit for you, you're then going to get to go on another lift on a completely different team for an additional 5 weeks. And some of our associates go on 3 or 4 of these lifts all throughout the company before they find the team and the position that's going to be the best fit for them at Cerner. I will let you know, a majority of our business consultants do go on to become business analysts somewhere in the company. So working with data, working with spreadsheets, analyzing the data, meeting with executives. So looking for people who are comfortable, working in Excel, working in large sets of data. Couple other things to note about this position: it does require a bachelor's degree, and we do have a 3.0 cumulative GPA requirement for this business consultant position. The next position I'm going to talk about is going to be our consulting analyst position. This is going to be another business-focused role that we have at Cerner. Our consulting analysts are actually the liaisons between us and our clients. So a very important thing to note about this role is this is going to be an 80 to 100% traveling opportunity. So like I mentioned, we have clients in every single state. We're in over 30 countries as well. The travel definitely will be domestic at first, but there could be the potential for international travel if that's something you're open to. Our consultants are really the ones that go out to our client sites, meet with our clients face to face, and help implement our software into their hospital system. So a typical travel week for consultants is going to be Monday through Thursday, Monday through Friday. There's not, a set area that you'll be traveling to, regional. It's going to be absolutely all over the United States. So as a consultant, you might be out on a project in California for 6 weeks, and then after that, your next client might be up in New York City. So it really just depends. We're looking for people that have great communication, great interpersonal relationship skills for this position, because like I said, you will be interacting with our clients, on a face-to-face basis, and obviously someone who's very open to travel. So along with the business consultant position, this consulting analyst position does have a 3.0 minimum cumulative GPA requirement, and we do hire a vast majority of majors into this consulting analyst role. The next position is going to be our Academy Technical Solution Analyst position. This is going to be more of a technical position. So MIS, information technology, computer science, really those technical majors are what we're looking for this Technical Solution Analyst position. What our TSAs do is they're essentially our Tier 3 support role. So they're actually working with clients over the phone, over email, helping troubleshoot issues that are happening within our software. So this is not going to be, a Tier 1 support role where you're answering phone calls, fixing printers or anything like that. These are going to be issues that have been absolutely escalated to the very top, where there's actually an issue in the code of our software that you're going to, work side by side with our engineers, actually be diving into that code to help troubleshoot issues. So if you've had maybe a few programming classes and think, I'm very interested in technology, but being a full-time developer probably isn't for me, this might be a great role for you, because you still get to have that client interaction, still get to work in technology, but more on a troubleshooting, problem-solving basis. The next role is going to be our Academy Software Engineer opportunity. So this is just going to be our typical, entry-level software engineer. So if you're a computer science, computer engineering major, you love to code, you want to be a programmer, this is going to be the fit for you. We have a great training program called the Dev Academy for our entry-level software engineers. What that looks like is your first 2 weeks of training is going to be classroom-based training, really learning the ins and outs of Cerner, We use the Agile methodology at Cerner, so you'll get familiar with that. And then after those initial 2 weeks, you're then going to move on to something we call the Dev Center. What the Dev Center is essentially a very safe environment where you'll actually start coding on real life, meaningful Cerner projects. And you'll do that in a very safe environment. So you'll have a mentor that will be looking over your code, there to answer questions, really help you along that way as you transition into a full-time engineer with us. You can be in the Dev Center from anywhere between 2 to 8 weeks, really depending on your skill progression. And then after that, you'll be placed on a team and kind of start jumping in. So like I said, if software development and writing code is something you're interested in, this is going to be such a great fit. Our software engineers here at Cerner are really passionate about the work that they do, and the solutions that they're coding and the software that they're writing is actually affecting people's lives and the health of people on a day-to-day basis. So if you want to be a developer and be very passionate about what you're working on, this would definitely be a great fit for you. And then the last role I'm going to talk about is going to be our Academy System Engineer role. So this is also going to be another technical opportunity. When I was mentioning before the data center and kind of how we store and maintain that data for our clients, that's where our system engineers are going to come in. So our system engineers really work on the entire infrastructure side for our clients. So working in Linux and Unix, working in databases, writing SQL, doing different PowerShell scripts, really kind of going to be more on that hardware side, really making sure that our clients are getting the data they need exactly when they need it. Obviously, healthcare data is something that has to be running and has to be up and working at all times, because those are people's lives at stake if that data isn't accessible to our clients. So our system engineers are really passionate about the work that they're doing, that they know that they're keeping that data up and running for our clients. Obviously, have a great training program for this as well, called our Tech Academy, which is going to be about 4 to 5 weeks of classroom-based training as well. And then in terms of our internship opportunities, we have 2 different internships that we recruit for the summers. It's going to be our software internship and our system internship. We're really passionate about our internships. You're actually placed directly on a team as an intern. You're going to be working side by side with our full-time engineers as an intern. So you're not going to be working, with a group of other interns or kind of doing any fake made-up intern projects. You're actually going to be working on actual projects that we're pushing out to clients or pushing out internally here at Cerner. It is a paid internship. If you're not originally from the Kansas City area, we do provide free housing in Kansas City for all of our interns for the summer. To let everyone know, we are completely full for this summer's internship just because we're getting so close. We'll actually start recruiting for our 2018 summer internship as early as this upcoming September. So I would say if you're interested in our internship opportunities, fall would be the best time to go out and apply and kind of start working through the interview process, because we do have a very competitive internship program, and we typically fill that internship up around the December or January timeframe. So talk a little bit about the benefits that we have here at Cerner. Obviously, we're a really large company, about 24,000 associates, so we have great benefits for all of our associates. We have 4 campuses here now in the Kansas City area, and at all 4 of those campuses, we have an on-site fitness center, clinic, and pharmacy. So your primary care physician can actually be at the exact same campus that you work at, which is definitely really neat. Like I said, we manage our internal health of our employees so well that other companies have us come in and kind of implement the same sort of clinic and pharmacy and healthcare setting and implement those different programs we have for our associates as well. We do offer tuition reimbursement after 2 years of full-time employment at Cerner. So if getting a higher education degree, maybe your master's degree, was something that you've always kind of had a goal for yourself, we would be able to offer up to $5,000 per academic year towards that degree for you. We have medical, dental, and vision health benefits. Cerner is jeans casual, so we do wear jeans to work every single day, which is one of my favorite benefits here at Cerner. We have a 401k, an associate stock purchase program, and we also have on-site cafes at all 4 of our campus locations. And with that, I'm now going to pass it over to my associate Taylor, and she is going to talk a little bit about our IT work sites and kind of some of the different opportunities that we have there.
Okay, hi everyone. Can you hear me okay? I hope you can. My name is Taylor Hill, and I am one of the 4 recruiters within our IT Works division here with Cerner. And so basically, I'm just going to give you kind of a high-level overview of IT Works and some of the opportunities that we have. So we have hundreds of clients, all over the world. But our IT Works division is a strategic alignment between Cerner and a client organization. So through our IT Works, our teams and our goals align. We try to become part of the client organization, and the organization's IT staff become Cerner's associates. So together what we do is we help our clients rapidly advance service delivery, improve the caregiver and patient experience, and further health initiatives in their communities. So we have these IT Works locations all over the country. We are we're global, so we have actually 23 here in the US and then 2 are global. But essentially, IT Works is a newer division of the company. It started here about 6 years ago. So essentially what it is we call it managed services. So this is basically where our clients have Cerner come on site and actually act as the IT department. So that is how these sites kind of differ from all the other clients that we have. We have a team that is solely based at the client site and is there to support the client in all capacities. So we're in charge of all of their network security, network infrastructure, Cerner applications, as well as non-Cerner applications. So sometimes these clients are actually operating on different systems, such as their HR systems, payroll systems, timekeeping, and they could be using other systems like McKesson, Epic, Allscripts, which are actually our largest competitors. So there are times when we're actually in charge of our competitors' applications as well. So with all of those systems at our client sites, at our IT Works sites, we're going to be responsible for any of the integrations, upgrades, implementations. So if they're going to be upgrading their software, going live with a new system that Cerner offers, or even implementing an entire new system, Cerner, our team there is going to manage all of that. As well as the day-to-day maintenance of all of the systems on site. So at these client sites, they really can range from anywhere from 6 Cerner associates on site to 150. So some of our larger sites are kind of what we call our collaboratives or our initiatives. We work with the University of Missouri in Columbia as one of it's called our Tiger Institute. So this is actually where we partner with the local universities there. So in Columbia and then also in Augusta, Georgia, we actually are in charge of all of the IT and technology with the hospital, but also with the local universities too. So in these roles, or in these client sites, we have all different sorts of roles that we hire for. So we have clinical informaticists. These people work more on clinical workflows. So in these roles, we're looking for someone that has a clinical degree, a nursing background, someone that knows the clinical space. We have anywhere from entry level to experienced clinical informaticists, and really all the roles. We do look for a huge range of experience. With our application consultant positions, these people wear a lot of hats. So they can be in charge of, we have revenue cycle application consultants, and anywhere to somebody working with power chart or different individualized solutions that Cerner has to offer. So in this role, what you're going to be doing is really being a subject matter expert in that one solution that you're going to be working on. You'll help the client with any issues that maybe arise from an implementation or integration, doing some of the design and build of those solutions, and really being face-to-face interaction, or getting that face-to-face interaction with the client, so the doctors, nurses, and physicians on site. And then we have some more of our technical roles, our information systems specialists. They also wear a lot of hats. We have people that work on the security side, so information security, trying to secure our network. As you can imagine, the data that we hold is very important and very and we have to make sure it's very secure. So we have our information security teams, we have data analytics, so we're looking for people to run reports and try to help the client be more efficient by looking at some reports and patient data and things of that nature. Our network storage specialists, obviously these people work on the network within the healthcare systems, making sure that nothing goes down and making any fixes there. So we have a lot of different opportunities, and then we have more of our kind of our functional side, which is our project leaders. Most of our sites have a PMO, a project management office there that they're in charge of some project initiatives that the client has, making sure we're meeting deadlines. A project leader is essentially a project manager, so you're going to be working on project deadlines with the client in that space. So we have a lot of different opportunities. These locations are, some of them can be in more remote areas within the country. We actually have Truman Medical Center here in Kansas City is one of our IT Works sites. The advantage to that is that they are located here in Kansas City. You wouldn't have to relocate anywhere, but they partner really well with Cerner, just being the only IT Works site here. They do a lot of reference visits where we take a lot of clients and prospective clients to visit Truman. So they're really a good example of our IT Works sites. But as you can see from this map, we have them all over. We're in Columbia, Missouri, and Springfield, Missouri at Cox Health. So those are some of the ones that are located closest to here. But we know we're in all different sorts of sizes of cities throughout the country. We do provide relocation assistance if this is somewhere that you would want to relocate to. And then after 18 months, you obviously do have the opportunity to kind of move about and explore other opportunities within Cerner. But these IT Works sites and these opportunities that we have here really are a good thing for you to kind of start your career, because they do show you how we really impact the client. Sitting in our headquarters, you don't always get to see exactly how Cerner is really affecting the patients and the clients and how we're helping improve their workflows. So although you would be located at one of these client sites, you would be a full-time Cerner employee or Cerner associate. You would just be part of our IT Works division. So you are eligible for all the benefits that Allie went over, everything like that. It would just be, you would be located at the hospital as opposed to in our headquarters here in Kansas City. So basically what IT Works does, we're responsible for all of that technology at those sites. And what we've found in the last 6-7 years is that it just allows our client in the hospital to then focus more on the patient care side and the clinical side of the work while we manage that technology. So just a couple facts. We do, like I said, we have 25 IT Works clients. That is a division of the company that we are expecting to see a lot of growth in the next couple years. We have about 1,600 total IT Works associates today. So fairly large organization, but obviously looking to continue to grow. So if you guys, anybody is interested in any opportunities within IT Works, we'd be more than happy to help you find the right opportunity.
Thanks, Taylor. Okay, hi everybody, this is Tessa Wood, and I am the Referral and Diversity Recruiter here at Cerner, and I manage in particular our diversity and our veteran recruiting efforts. So since Park has a large military population, we wanted to kind of quickly cover what Cerner's veteran efforts and recruiting efforts look like. So the quote up on the screen is a quote from Mike Nill, who is our Chief Operating Officer, and I'll let you guys read that yourselves, but it really says it all and why we truly value veterans here at Cerner. So, there are many reasons why we want to hire veterans and value veterans' experience and work ethic. Veterans are talented and motivated and dedicated, and they really take command of complex situations with skill and composure and discipline, which are all for here at Cerner. As we are continuing to really change the state of healthcare, as Allie mentioned, around the world, we need creative and influential and dynamic leaders to really drive our progress and success. So we're proud to say that we have hundreds of veterans and reservists that have joined Cerner, and we're always looking to add new sharp talent to our community and add more veterans into our population. So just to give you a little overview of a few of our different recruiting efforts within the veteran space, we have strong community involvement and partnerships with local organizations. We work with a few different active military groups out of Fort Leavenworth in particular, just because that's the closest base to us. So we have a close relationship with them and their career fairs and career service opportunities, as well as VA and veteran groups locally in the area in Kansas City that assist veterans in job seeking and mock interviews and resume review and kind of everything through the process of transitioning out of the military into corporate America. So that kind of leads me to the next point is we are a host company for Hiring Our Heroes, which is a fellowship program funded through the U.S. Chamber of Commerce. And through this program, you can host a cohort quarterly. It's across the nation, and it's a 12-week fellowship. So it actually just came to Fort Leavenworth in January, and we had our first group of fellows with us at Cerner. They did a 12-week fellowship, which is essentially an internship. So 12 weeks at Cerner is an internship before they've officially retired or left the military. It gives them that workforce experience, kind of view into corporate America before officially entering the workforce and civilian workplace. And both have gotten full-time jobs with us, and we're getting ready to kick off our next round of cohorts and fellows. So it's just another way we can really support veterans and military members that are transitioning out of the military into the workforce. Another program we're involved with is Army Pays. It's a partnership through the Army that allows for outreach opportunities and to connect with service members that will be leaving the military within the next few years. So it essentially, military members can pick Cerner as a company, and then whenever they are getting close to we'll get interviews with Cerner and potential employment with Cerner. So another way we can engage with the military. And then once you are in Cerner, we have a veterans community that provides support and networking and events internally. It was a grassroots funded group. So some Cerner associates that were veterans decided they wanted to put together this group a few years ago, and it's really grown and prospered since then, and it has quite a few members. And I know that they do different activities together, and it's really just a support group for both the veterans that have been at Cerner for a while, but also new associates to Cerner that recently left the military. Well, that is all we have in terms of our presentation. So open for questions now. Happy to answer as many questions as we can.
Yes, Allie, we had a question from YouTube, and it was, as a number of Park students are international, do you accept students or graduates who require the H-1B visa sponsorship?
Yeah, that's a great question. So we do provide H-1B sponsorship for one role here at Cerner, and it's going to be that Academy software engineer opportunity. So if you're an international student who's currently a computer science, computer engineering major, and that software engineer is what you're interested in, that would be the opportunity that we would be able to hire you into. Unfortunately, outside of that, if you are an international student, that would be the only opportunity that we would have here at Cerner.
Very good. Another question we had, so as far as the application process goes, do any of you have any piece of advice for that application?
Yeah, great question. So all of our opportunities are going to be posted on cernercareers.com. So that would be the website to go to kind of look at all of those opportunities. And I would say in terms of tips, really just be sure to have your resume as much up to date and clean as you possibly can. Your resume really is going to be your first glance. As kind of a recruiter looking at a resume, that's going to be the first snapshot I have, to kind of gauge you as a person. So make sure, I would say, that your resume isn't too cluttered. Definitely use Park Career Services. They have, a little plug for you, Leah, to be able to go in there, do resume reviews, have career services look over your resume, just because that is going to be the first opportunity we have as recruiters to kind of gauge who you are as a student, what you're interested in. So make sure that that resume is really reflecting all of the skill sets and experiences that you are bringing to the table.
Very good. The next question we had, what does Cerner call the sales rep position? Is it the consulting, or would it be a different position?
So the entry-level sales program is called the Client Representative Program.
Okay.
It's a training program to get you into the sales. So it's an entry level. It's really one of the
primary ways to get into sales at Cerner entry level, looking for about 2 to 8 years of sales experience.
And that's going to be post-graduation sales experience. So unfortunately, we don't really hire right out of college in terms of our sales opportunity. We actually do most of our recruiting for sales internally. So if sales is something, that you kind of see your pipeline for the future, that consulting analyst entry-level role is going to be a great starting point to really get into Cerner, understand our solutions, understand our clients, and then a few years down the road, kind of go into that sales opportunity.
Wonderful. As far as a hiring timeline for internships, could you give our students just an insight into that?
Yeah, absolutely. So like I said, we're completely full for this summer. We are going to start recruiting for our May 2018 internship program around late August, early September. So essentially right when school starts up again in the fall is when we start our recruiting process. So you can expect to see that software intern and system intern job posting to be put up, I would say early September timeframe, and that would be the best time to go. I would say if you're obviously, I guess it's going to be May 2019 graduate or December 2018. We typically like to hire juniors into our internship opportunities, so the summer before your senior year.
Very good. I have a military question. 18 months out from military retirement, is it too soon to look into Cerner?
Definitely not. I think that if you're getting close to retirement, or if you're 18 months, or I even had someone that just emailed me that's 3 years out, I think it's always good to start looking sooner than later and really understand the industry and understand the company and what it has to offer and what the opportunities look like. Now, it's definitely too soon to apply, but I think to get your feelers out there and just kind of look at what the overall opportunities look like. They could change within 18 months and we'd have different opportunities, or business changes could kind of alter, but I think it is good to start exploring companies and the different career paths that you'd be interested in taking.
Great. As far as for MBA grads, would they be looking at any different positions than a bachelor grad would be looking at?
Yeah, absolutely. So I hire MBA grads into our entry-level opportunities. Absolutely. So I definitely hire a mix of bachelor's degrees and MBA degrees into those entry-level opportunities. We do have a lot more direct placement opportunities. I will let you know that most of our direct placement opportunities are going to be some sort of work experience post-college. In addition to that MBA or bachelor's degree. So it's really going to kind of depend on the individual student and what their background looks like in addition to that MBA. But just kind of to answer your question broadly, I do hire a lot of MBA students into those entry-level programs as well.
Okay, great. To kind of piggyback off that, would you hire an MBA student for an internship position?
Yeah, absolutely. So if you're in terms of those technical degrees, if you're getting more of a technical flavored master's degree program, like I said, unfortunately, the only internship opportunities we have are going to be on that technical side. So either software or system intern.
Okay, very good. Very good. A couple more coming in. Are there any direct placement opportunities for a Master's of Healthcare Administration?
Yeah.
And what experience is best?
We have a lot of direct placement opportunities into our consulting department. So that's going to be where, we hire a lot of those healthcare background majors. If you go to cernercareers.com, you can actually filter on those specific organizations. So I think that would be a great thing to do, is just to go out to cernercareers.com, kind of filter on consulting and more of those health-focused opportunities. And then all of those opportunities we have right now are going to pop up, and you'll be able to kind of click through all of those individual job postings. Obviously, we post new positions every single day. So if you don't see something right now that's maybe the perfect fit for you, definitely keep checking the website, because we have new opportunities come up every single day.
Very good. What programming languages are most popular at Cerner for that entry-level developer position?
Yeah, so the really cool thing about Cerner is, we're a software company. We're not a company that does something else but needs software engineers. What we do is develop software. So we code and work in almost every single software language that you can imagine. So we're not, a 1 or 2 language company by any means. We're essentially looking for engineers who are open to learning new languages. Obviously, we do a lot of object-oriented programming, Java, C#, C++, Python, Ruby on Rails. Like I said, really anything you can think of, we probably have some team somewhere in Cerner working in that language. So one of the things that an engineer told me once that has kind of always stuck with me is here at Cerner, we would rather hire someone who knows a little bit of a lot of different languages than someone who, is an expert in Java but doesn't want to do anything else their entire career besides Java. So just because we're doing so many different things.
Absolutely. Well, thank you so much. We really appreciate you joining us today. Do you have any questions for us or any last pieces of advice?
I don't think so. I would just say for everyone who's listening, in terms of, what your next step would be like, cernercareers.com is going to be where you're going to find all of those opportunities. I will, in terms of the business opportunities, the business consultant and consulting analyst, you won't see those posted right now just because we have wrapped up hiring those for the rest of the summer. We do have another business consultant start date around the November timeframe. We'll probably start recruiting for around late August, early September. So definitely feel free to check the website then. But we'll start recruiting for all of our 2018 start dates around that August or September timeframe. So that's going to be the best time to go into that cernercareers.com and get your application submitted.
Great. Well, thank you all three. We appreciate you being on the call.
Thank you so much. Have a great rest of your day, everyone.
Okay.